Hi, everybody. Welcome to Behind the Breath. This is the official podcast of the American Association for Respiratory Care. I'm your host, Monique Kimmel, Vice President of Membership and Customer Care for the AARC. And today we're diving into the story of two new grads who are already making waves in the profession. Joining us is Adam Ibrahim and Ashley Statler, recent grads of the University of Maryland Medical Center. Adam is also a leader of the AARC's Next Gen RT Network community. More on that later. Adam and Ashley bring a fresh perspective, a strong voice, and a passion for leadership that represents the bright future of respiratory care. Whether you're just starting out or have years of experience under your belt, Adam's and Ashley's stories are sure to inspire. So let's get started. Adam and Ashley, again, thank you so much for joining us today. If we could just start with a little bit, tell us a little bit about yourself, your respiratory journey, and sort of what inspired you to go into respiratory care.
Well, thank you for having us, Monique. I really appreciate that. It's great to be on today. I guess I'll start off. So firstly, my name is Adam Ibrahim. I'm a respiratory therapist at the University of Maryland Medical Center. I went to Salisbury University, graduated class of 2024. I'm from a small town just north of Baltimore, about 40 minutes north, called Fallston. And I got into respiratory therapy through a fraternity brother of mine actually introduced me to the field and introduced me to a counselor who was a professor as well at the time. His name was Randy Inslee, and he was very inspirational about getting into the field. So that's kind of how I found my niche into this, the respiratory care.
That's great, Adam. Thank you. What in particular was it about the field that kind of, drew your interest, if you will?
So there was quite a lot. So he was mentioned a lot about the ability to travel in the field. So interestingly enough, he himself was actually from around Baltimore, the area. He had worked at the University of Maryland Medical Center a long time ago in the 70s. And he just was explaining lots of avenues for career advancement, one of which was, just the ability to travel around. He made his way all the way up to a director at a large facility near Las Vegas, which was very inspirational for me as well, and then led on to teach and into his 70s as well. So it was a very, very phenomenal experience that a lot of life experience from Gramps.
That's awesome, and it's true. There are so many different career ladders that you can ascend as an RT. Ashley, how about you? Tell us a little bit about your journey and why you became a respiratory therapist.
Yeah, so again, to piggyback on what Adam said, thank you for having us. This is an awesome opportunity for us as I know Adam has a little more experience than me, but as a new grad, to get myself out there and speak about my experience so far as a student and a new RT. So my name is Ashley. I am 25, and I just started at University of Maryland Medical Center as a registered respiratory therapist. I graduated from YTI Career Institute in York, Pennsylvania in May of 2025. So I am just learning my way around the career so far. I'm relatively new. I did about 7 months of clinical rotation at University of Maryland Medical Center, so it was nice to be a little bit familiar going into it. As far as how I found out about respiratory, I actually didn't know what respiratory therapists were, what they did. I was previously working in medical billing, some administrative work, and I was just so bored with it. I was like, I need to do something else, get on my feet, do something. And there wasn't a lot of opportunities for advancement. So it was between going back to school for ultrasound sonography or going for respiratory therapy. And I got accepted to respiratory therapy program first. So that's the route that I pursued, and I have been loving it ever since.
That's so exciting, and that's great to hear. Thanks for sharing.
Yeah.
So, hearkening back to your long, long ago experiences as a student, would love to just hear about some of the experiences that you did have and just any stories that you might want to tell about student life. Adam, we'll go ahead and start with you.
Yeah, so I actually only had one scheduled rotation with the University of Maryland Medical Center as a student at Salisbury. So lots of our clinical rotations were done with Tidal Health Peninsula Regional, which is a trauma center located on the Eastern Shore, just for geographic concerns. So we had one rotation at the University of Maryland Medical Center. My rotation was in the cardiac surgery intensive care unit, which was just a complete step ahead in terms of acuity that I was ever familiar with, with especially having very little to no experience at the time in a center like that. It was a phenomenal experience when I went and saw lots of very high acuity patients with ECMO machines. They do veno-arterial, so VA ECMO, and cardiac surgery. I remember my experience as a student was that the respiratory therapist that was my mentor at the time said that if you can work here, you can work anywhere. And that was kind of a little scary, obviously, coming in as a student. But I really admired the challenge, and I really admired the, high acuity and of the unit in its entirety. And I wanted to throw myself into a place where I could get as much experience as possible and be able to see pretty much everything. And that's what I did. That's how I found the University of Maryland Medical Center as my first
Wow,
institution.
that's great. I mean, it's sort of out of the frying pan into the fire. I mean, that's the way to get your feet wet. That's for sure. How about you, Ashley? What were some experiences as a student that kind of stood out in your mind?
Yeah, absolutely. So I spent a lot of time in different units throughout University of Maryland Medical Center, but I spent a lot of time specifically in their medical ICU, which has a wide variety of different patients that are usually very chronic and they are in very like critical condition. Maybe not to the same extent as like some of the trauma patients in the trauma building, but their medical ICU is in their main house. So it was a really good place to dive in and see what all they had to offer as far as respiratory goes, because you have several patients on different respiratory modalities. So I feel like it was a good place for me to get exposed to all kinds of different patients and situations. And I had a clinical instructor who she said the same thing that Adam had heard as well. If you can work here, you can work anywhere. It's a very challenging place that relies very heavily on their RTs. They have a lot of autonomy and practice very high in their scope. So you really get to feel what it's like to be an RT that is well respected, that your opinion's really valued there by the care teams. So I had a lot of chaotic kind of experiences, but also got to learn some very basic things that I felt made me very well rounded, and has been very helpful so far in my journey of starting as a new grad RT.
That is great. And again, just great to hear these experiences that have shaped you. And Adam, did you want to say something else about that?
Just to touch on the medical intensive care unit, they have a lot of residents that come in and out of there, so it is a great teaching unit. Um, it's it's very phenomenal. They'll do the optimal PEEP titrations, all kinds of oxygenation indexes, just lots of things that come straight from the textbook. So just wanted to throw that in.
That's awesome. And those clinical experiences really, not only do they shape you, but it also really helps anybody who's questioning it all. Is this really the field for me? I mean, this is sort of a, hey, this is what it's going to be. We're either going forward with this or not. So I'm glad that you had that experience and were able to make the choices that you did. I'm going to direct this one to Ashley. What were some of the clinical experiences that you had during your training that really made the biggest impact? I know you've talked about a little bit, but was there anything else that kind of stood out in your mind?
Yeah, so I actually remember specifically one patient. Obviously, I can't get too into detail with this, but it was a patient that, we had helped her get from her bed to a chair, and she was just so emotional. That was such a big thing for her after being, stuck in the bed for so long. And she was so emotional and so excited about it, and that really made an impact on me because it felt so rewarding to know that just something even so simple for me as helping a patient get from one place to another. It's like nothing for us, but it was everything for her. And then, so that was while I was a student on my clinical rotations. And then I actually saw her later. she was a post bilateral lung transplant patient. I
Mm.
saw her later as an RT, and she remembered me, and it was like so rewarding. I was just like so happy to see her doing so much better, post transplant. Um, and that really like stuck with me because I'm like, these patients, they make such an impact, with,
Yeah.
because of how severe their health conditions can be. It gives you a greater appreciation, I feel like, for the body that we do have, and the things that we can do, and that we can use that to help people in, on some of the worst days of their life.
Sure. And just such a sense of purpose, I'm sure, just seeing the results
Yeah,
of your treatment. Oh, that's awesome. Um,
absolutely.
Thanks for sharing that, Ashley.
Hmm.
Adam, I'm going to ask the next question to you about sort of like looking back at your education. How did that help to prepare you for now that you're into it a bit more, in terms of, being in the profession and out of your student years? How did that studies and the different experiences that you had during your education, sort of help to prepare you for the realities of working in the field of respiratory care?
Yeah, so that's a good question. Just in a brief cover up of the education that uh, we kind of outlined in college. Um, they only have about 2 years to teach you how to be a respiratory therapist, right? So they are on a time crunch. They did, I believe, at least my personal experience at Salisbury University did a fantastic job of really showing us all of the different, equipment to use, everything from the Draeger V500 all the way down to an IPV machine. So being able to, from a physical approach, to be hands-on, capable of using that equipment uh, in your day-to-day practice is very important. Um, I also think that they talked a lot about specific, disease processes. Obviously, we have lots of, in like the medical ICU patient populations, will have patients with very like obstructive disease, like end-stage COPD. They talk a lot about that. Um, they talk a lot about watching, your pressures, your mean airway pressures, and venous return in units where that would matter more in cardiac surgery. One thing that it does, it can get a little tricky with walking into the field, which is another part of this question, would be, having to balance out having to correctly ventilate somebody with, multiple things wrong, comorbidities, right?
Mm.
If you have, an end stage COPD patient, with cardiac abnormalities, how are we going to tackle that? How are we going to be able to properly, ventilate this patient? And I think that the education wise, in the classroom can teach you a lot about these specific the physiology of all these different disease processes and how to manage them. But it can be a little difficult with application. So I think that they did. I think that my university did a great job of outlining, like, the basic things, how to use the equipment. But I really think that in practice, you learn exponentially more, and especially at a level one trauma facility as well. So,
Thanks about that. And I'm just got a quick follow-up question. You mentioned a lot of the challenges, just, the different clinicals that you did face and just the real life practice, just the issues that you were facing that you would face in the real world as a student. How did you ever get to a point where, did you feel overwhelmed? And if you did, because again, it's a relatively short period of time and you are literally just almost like the Spock mind melt. You are just having to absorb so much information and then be able to, have the application thereof. So how did you sort of manage your stress, or how did you help to sort of overcome any, if you started to feel a little bit overwhelmed?
yeah. So, in my experience, and I know keep bringing up University of Maryland, but that is my experience so far. We do have, a lot of seasoned respiratory therapists that have been in the field for a very long time that can help, teach you different ways. And, my supervisors have done a fantastic job of really teaching me a lot about how to tackle these complex cases and how to do these, very complex with lots of comorbidities, patients with lots of comorbidities, for lack of a better term. And then also, we work and we use a multidisciplinary approach to solve these issues here. So we have the backing of our physician teams and our nursing teams. People work together, and that's the important part. The important takeaway, especially one of the most important takeaways in healthcare, is that we need to all work together as a team to solve these problems, because it doesn't just take one brain. It takes a team.
No, I love that. And that's so true. And I think that also helps to highlight, if you will, the importance and the specific and unique, profession that we have in terms of respiratory care. It is different and unique, and maybe not as well known as some of the others, but it certainly really helps to shine a light on that profession when you're working with all the different teams and they see what impact you have on the patients.
Yeah, absolutely.
So that's great. Ashley, quick question for you. Now that you have transitioned and now you're a little bit newer into the actual field, what were some of the things that surprised you the most when you transitioned from student to actually being on the job?
Yeah, so I was kind of thinking about that, and I feel like a lot of what I learned in school was the actual, obviously, the treatments and the modalities and the disease processes and things like that. So I feel like as a student, I kind of went into it with a mindset of like, what tasks can I complete, to help this patient feel better? But I feel like now I'm learning how to think like a clinician rather than just a person doing tasks or checking off things off of a list. So I feel like it can be a bit overwhelming at first, but you're very well, respected by a lot of the team, specifically in the hospital that we work at, and they kind of expect you to know what to do next from a clinician standpoint. So I feel like it gives you a sense of pride knowing that somebody wants to come to you, for your suggestion. What do you think as a clinician that we can do to help with this patient? So that we can, improve their outcome as best as possible.
Right. That's great. And that's true. And it also gives you a little bit more confidence too, to see, hey, this is an impact and it's respected. So I love it. That's great. Thank you. Adam, quick question about, again, sort of on the lines of, feeling overwhelmed and stressed, but how do you stay motivated and growing professionally now that you're out of school a little bit longer?
So just about with your career and just about anything in life, you really get what you make out of it. That applies to education. Yeah. It applies to your career, whatever you do. It's not just respiratory care. So to stay motivated and to try and, progress this profession, you want to leave things better than where you found it. I've always considered myself as a motivated person. I think that one of the most motivating things is seeing students come in, because we do work in a teaching facility, and ask all kinds of questions about some of the things that we do, and that's very motivating. Working with a great team that really values your opinion on how to help your patient, that's very motivating. Just trying to give it all you really have, to improve outcomes and to progress yourself as well, and to be there for everybody else when they're there for you, and try to progress your career.
And I'm sure, hearing now, when you get both of you, probably when you hear questions from students, especially just coming in, you're probably realizing that I know a lot now. Right? I got this. Right. I was just there a couple of years ago. I got this. So that's got to make you feel really great and build your confidence too. Kind of for both of you, I would love to hear a little bit about your goals for the next couple of years. I know it may be hard to know because you're still exploring different avenues and looking at different things, but what are you looking at as you start to grow in your profession, and do you have any goals for the next few years? I'll start with Ashley.
Start.
Okay, no, you're fine. So currently I'm in this respiratory residency program at University of Maryland. So they like to think of your first year here as like your third year of RT school because you're going to keep learning and get trained within the different, um, units and buildings within the hospital. So my goal is to just soak up as much information as I can in a facility that offers so much, as far as learning opportunities. And then I would like to just participate in as much as I can. They offer a few different areas that therapists can practice in. So you have like your bronch suite, your PFT lab, your HBO, things like that. You have your trauma building, your main house building. So I'd like to just soak up as much as I can. I like to think of myself as like a sponge in this time of my life, just getting as much as that I can use in the future, and then work on pursuing education. Getting my bachelor's degree, and then potentially thinking about where to go from there. I am interested in the new APRT, the Advanced Practicing Respiratory
Great.
Therapist. I
Right.
think that that's super awesome, and is a great opportunity for therapists to move up to that mid-level practicing provider. So I like to eventually maybe pursue that, but for now, just kind of focus on just being a solid respiratory therapist and learning what I can from my peers.
That's awesome. And you're kind of getting exposed to so many different things that you really can start to look and see maybe I do want to specialize in one thing. But getting this really great, round experience is wonderful. So thanks for that.
Absolutely.
How about you, Adam? What are you looking at? Sort of, you're a little bit further, I know. So what are you looking at now in the next few years?
Yeah, so the next few years, so I want to definitely take my acute critical care specialist exam, just to try to add to the stream of letters. I think that uh, that's something that I've been looking into as of more recently, and then also training in the NICU, so the neonatal and labor and delivery. I think that that's very interesting part of our field. So that's where I've just started. I'm actually starting this week with that.
Oh,
So,
that's
and
great.
then as for a little bit longer term goals, the advanced practice respiratory therapist is a whole brand new mid level provider thing, just like Ashley was talking about, something that I'm definitely taking a look at into. And then also, it really all kind of depends on where life takes me. If I could find maybe a supervisor level position in the next couple of years as well, work my way up the clinical ladder. So um, yeah, those are some of the short term goals that that I've been taking a look at.
That's great. That's exciting news. And you probably know this already, but we do have a lot of specialty sections within the AARC. And one of those is neonatal peds, and there's diagnostics and acute care and ambulatory acute care, so transport. So there's a whole slew education. So there's a lot of different ways that you can also start to become more honed in your skills even within the organization. So that's great to hear, Adam. And congratulations on starting that. That's awesome. The neonatal. That's good. I'm going to kind of ask, I'll start with Ashley, but I'd love to hear from both of you on how you see the RT, the respiratory care field sort of evolving. And how do you hope to contribute to that?
Yeah, so like we both kind of mentioned with the advanced practicing respiratory therapist role, I think that's really huge for our area in healthcare, and I would love to see that expand, and become a thing in more states, so that we have opportunities and that other RTs now have opportunities to potentially move forward with that in their area. I think that would be really cool to see. And I personally would just really love to get involved with some of the younger generation, like high school kids, maybe even early middle school kids, just let them know like what respiratory therapy is and what we do. Because like I said, I really didn't know. And if you're not somebody who's ever worked in the hospital or have, family that's maybe or yourself that's never really been in the hospital, a lot of people don't know what we do or have even ever seen a patient on a vent or anything like that. So I'd like to just put us out there, get involved with some of the younger generation and let them know that this is a career option, that you can have, that you can obtain in as little as 2 to 4 years, and just get more people involved, so that we can promote ourselves as a career.
It'd be great. I mean, I agree with you. I think there's so much more that can be shown about the profession to the middle school, high school students. I know a lot of the vocational schools that are out there have a
Yeah.
nursing track or a radiation technician track, but I don't see very many with respiratory therapy. So it would be great to get
Yeah, yeah, I
exposure.
agree. I actually, my senior year of high school, I went to Votech to be a medical assistant, and never heard about respiratory or anything like that. So I would love to just put it out there, put
I
these
love
ideas in in these, so that the kids know that it's an option that, something that they could pursue if they're interested.
That's great, and it's a growing field, so it'd
Yeah.
be great to get into. Adam, how about you? How do you see sort of the field in general evolving, and how do you hope to contribute?
So I do think that the field, has definitely grown. I think, and I'm a little bit newer to this, so I didn't really see how the pandemic contributed to
Yeah,
respiratory
yeah,
care. Obviously, that was something that where respiratory therapists were greatly involved in.
yeah, yeah.
Um, and I think that one of the things that we can really do to grow the field, obviously, just bouncing off Ashley, uh, is to really advertise. Get into the high school crowd,
Yeah,
the
yeah.
earliest middle school crowd. I do see the field definitely evolving in a sense of where the ARC where they have come from and how much they've
Yeah.
grown. In practice. So I was first introduced in to respiratory therapy. I started my program at Salisbury in 2022. And I didn't really know anything about the ARC at the time.
Yeah.
I think that the ARC has definitely grown a lot since then, although I am still pretty new to the field. So it's hard for me to be able to give a just answer on how much they've grown. But I definitely have seen a lot more coming from the AARC as I've gotten involved into practice. Um, as for the what I plan to do with with in my career as a respiratory therapist is definitely to, like I mentioned earlier, is to uh, leave it better than when I came in. To really work on one of the things that I really wanted to work on is to beef up a mentor program. Uh, you know, um, to really have somebody to fall back on while you're trying to learn all these subjects in school. Um, but yeah, I really do see the field growing. The field itself too is much newer than a lot of the of that of our nursing colleagues
Right.
and obviously our physician colleagues. They date way back hundreds and hundreds of years. So um, the field is newer. I believe that it will grow substantially, especially with technology advancing. The ventilator didn't really exist 100 years ago, so
Yeah, yeah, yeah.
you know just the basic principles of that. I definitely see the field growing.
Well, I'm glad you mentioned that. I'm glad you mentioned mentorship too, because the AARC has a mentor hub for members, and it's through AARC Connect, and it is sort of like a Match.com except without any kind of that kind of a relationship. It just matches people, and it could be geographic, it could be by specialty, it could be by years of experience. So, encourage everybody to go on, sign as a mentee or a mentor depending on where you are in your career, and really get to meet people and other RTs around the country. So no, thanks for that Adam. I'm excited to see where this evolves too. I think the technology just keeps changing, and it's exciting to see all of that. And maybe through the advanced degrees, it's going to be even more, applicable to what RTs do in clinics, and keeps exciting changes coming down the pike, I think. So, um, if you both had to think about this, what is one misconception about the field, about being a respiratory therapist, or the sort of the profession of respiratory care that others have? And it could be, it could be other professions, it could just be the public general. I mean, have you seen that sort of a misconception that you would love to dispel? And I'll start with Ashley.
So may not have too much of an insight with this, just being pretty new. One joke that I feel like I always hear is just people say, well, albuterol fixes everything. That's, the running joke. There's way more to it than just us giving breathing treatments to fixing everything. We are involved extensively in the patient's care, in managing, their cardiopulmonary status and assisting with that. So I think just knowing that we are more involved than people think we are. We're not just giving breathing treatments or just putting the patient on oxygen and walking away. We're looking at everything. We're looking at all their lab values, looking into their medical history just to see, like, is this related to something else, or, could this be caused by some underlying issue? And we are working with the team to all work together to do that, with their physicians and all the other people that work a part of the team in the hospital.
Thanks for that, Ashley. And I'm going to go ahead
Mhm.
and pitch that to Adam as well. And then I'm just going to have one more quick last question. I know we're getting up on it here. So, and Adam, what about you? Is there a misconception out there that you would love to dispel?
Yeah, so I know we get the knob turner comment sometimes. Well, the ventilator is a very complex machine, you know.
Sure.
So and with and in my experience, it is in all of our adult units, we are a protocol based facility. So the saying knob turner doesn't really exist actually at
Yeah.
all,
Yeah.
really in
Yeah.
our facility.
Yeah.
We a lot of times, especially at nighttime, we're steering the ship with weaning and extubation, especially in that unit that I was mentioning earlier, cardiac surgery. Lots of wean extubates. So we're basically weaning sedation. The patients are taken straight up from the OR. We wean sedation. We wean the ventilator, and then we extubate them. So I would suggest that but we are definitely a lot more than just a knob scrubs and turning knobs. We definitely are very heavily involved in complex cases with patient care, uh, and we are an essential part of our multidisciplinary team.
No.
And anybody that works uh, in a hospital uh, will should know that and should understand that. So
Yeah. No, and thank you for that. And I mean, we have stories to tell, and the stories are powerful, and there are just some amazing things that RTs have done for patients in their care. Just one final question. And again, I just want to thank you so much for joining us today and telling your stories and your experiences. What piece of advice would you have for somebody deciding on whether or not to go into respiratory care? Ashley, I'll start with you.
Yeah, so I recommend, if you have the opportunity, just reaching out and shadowing a therapist if you can,
Yeah.
and just seeing all that there is to see, um, and just do some research. Take a look, see what we do, and then if you are a student currently, getting ready to attend clinicals or you're on clinicals, I always encourage everybody, because people tell me this, ask questions. There is no dumb question, like we are constantly learning. I know there are, seasoned therapists that have been in the field for 10, 15, 20 years, and they still tell me they're learning every single day. So ask questions, get involved with everything that you can. If you're a student, go to rapid responses, go to codes, go to whatever you can, to just see, because experience is everything. You can see so much stuff, and it really helps in the long run, because that could be you one day. And you'll think back to those moments where you're like, oh my gosh, I've seen this before, I know what to do. So just research what you can, get involved, see what you can. That would be my advice for anybody who wants to get into the field. Um, Shadow somebody and just see if you like it.
That sounds great. Great advice, Ashley. Thank you. And Adam, what are your thoughts on that?
yeah, so if you're definitely Ashley, that was a great answer. If you're thinking about getting into the field, definitely consider a shadow day. And not just maybe one shadow day. Try and shadow at a facility where you'll be able to see as much as possible. Again, there's lots of different things that we do, and what our job description looks like in one unit will vary differently from another unit. And what the kinds of work that we're going to be doing. So yeah, absolutely shadowing. One piece of advice that I would give for students would definitely to get a part of to come and take a look at the ARC and join. You know, creating connections matters. Being able to hold conversations matters. You know, trying to definitely reach people in different parts of the country. You know, that definitely matters. Definitely attending conferences. A conference by the sea is something that's very popular in Maryland. It's a conference in Ocean City. So attending professional conferences, that's another great way as a student to really make connections and meet people. You know, we live in a more connected world than we've ever have been before every day, and just completely fully take advantage of that. You know, because there's a lot of different opportunities everywhere that you can make of it. So.
Appreciate that. That's a great answer, Adam. And you're right. It's the connectivity is so important. We have within the AARC, and thank you for that plug for the AARC. It's true. It's just how it really could broaden your horizons in terms of who you meet, what you learn, just really being able to help you continue to grow within the field of respiratory care. We have a new Next Gen RT network for students and for new grads that helps to get that conversation started. So thank you for that. And again, thank you both so much for sharing your insights and your energy and your vision for the future of respiratory therapy. Really appreciate that. And thank you for listening to Behind the Breath. If you've enjoyed today's episode, don't forget to subscribe, share it with your colleagues, and check out more conversations in the AARC newsroom at aarc.org. And until next time, keep breathing life into the profession and each other. And thanks again for today.
All right. Thank you for having us, Monique.
Yeah, thank you.
Thank you.